So we were talking about how common complications are, and let me tell you that last year, 60,000 people had a toe, a foot, or a leg amputated.
60,000 people?
That's a lot, isn't it? And you know, the main concern is that a lot of these things could have been prevented if these people would have taken care of themselves. Now, when we're talking about complications like this, we're talking about people that are in their 40s, 50s, or 60s in general. And one of the concerns that we have now, and I'm sure you've seen it at your school, is that a lot of younger kids are gaining a lot of weight. Because instead of having a good diet and exercising, they just go home and sit in front of the computer or the TV and start gaining a lot of weight. So now a lot of those kids that are 15, 16, 17 years old are becoming diabetic very, very young in life. So their probability of having more complications is even worse than what their parents did 20 years later.
So when I was doing the family tree, I saw that on my father's side and my mother's side, people had diabetes.
So do you remember who had it and who didn't?
My grandfather, my grandmother on my dad's side.
Okay.
Even my dad had it. And on my
Okay.
mom's side, my grandmother.
And your mom has it?
Uh-uh.
So, for example, this is an important observation. I don't know if you talked about family trees and diseases that are genetic, like when you get it from your mom, and then you get it, and then your kids get it, which is what's called vertical transmission. That is not something that you see in diabetes. In diabetes, you see that several members in your family are going to be affected, but it's not organized in a way where it goes from grandparents or great-grandparents to grandparents to parents to children.
So how do you know when you have diabetes?
Well, the only way you really know that you have diabetes is by having a blood test. So what happens is this: half of the patients do not have symptoms, and the half that have it can be tired, can be exhausted at different times, can be having some of the symptoms, which is related to drinking a lot of water or things like those. But at the end, having a blood test is the only one that it's going to tell you if your blood sugars are normal, they're a little bit above normal, or if you have diabetes.
So what is pre-diabetes?
Prediabetes is when you have a blood test and instead of having completely normal levels, they're in between normal and high blood sugar. So instead of having 100 milligrams per deciliter, you would have, let's say, 120 or 130. And that will kind of ring a bell in terms of saying it's a little bit high, maybe we need to check it again, or maybe we need to see if we have to worry about diabetes at this point.
So I don't think I have anyone in my family with diabetes. Does that mean I'm not at risk?
Well, I think that you would be at risk if, without having the genetic component or somebody sick in your family, you would gain weight. So if you stay thin through your life, most probably you will not develop diabetes. If you gain weight, you will have a higher probability of getting the disease.
Is diabetes contagious?
No, it is not. In comparison with the diseases that are caused by germs, like a cold. If you're sneezing all over the place, right now, if you were sneezing all over the place, most probably all of us would get infected. But that's not the case with diabetes. Diabetes is a genetic disease that is going to be triggered by people that gain weight. So unless you have that genetic component, you don't get it, and you don't get it from anybody else.
Okay.
So the bad news is that if we don't take care of it, we can have a lot of complications. Diabetes is a disease that kills in an awful way, and people end up having amputations, having eye problems, losing their sight. Blindness is one of the most common causes. Diabetes is one of the most common causes of blindness, kidney problems, etc. So we need to take care of the disease. The good news is that although diabetes is a very serious disease, there are several things that we can do at different times in our lives to try to prevent it or delay it.
Like what?
Well, if you come from a family that has diabetes, is there anything you can do about your genetic background? Can you change your genes?
No,
Can you change the environment in which you live?
not really.
Well, you can, in the sense that if you are having a diet that is making you gain a lot of weight, you can change your diet. If you want to lose a little bit more weight, you can exercise. So a healthy diet and exercising are two of the most important things that we can do to try to avoid diabetes.
Well, maybe I should be tested.
Well, if we think about your genetic background, that is of concern. So it's something that you would like to do, but not at this point because you're very young and you're thin. So I don't think you have anything to worry about. You can think about it, and maybe by the time you turn 25, you can start checking your blood sugar to make sure that it's normal.
Thank you, Dr. Aguilar. I feel much better now.
I'm very glad I was able to help you. My pleasure.
Thank you for spending your time to teach us.
Anytime.
Yes, and thanks for lunch.
Yeah, thank you.
Good.
Well, I hope you enjoyed it. And remember, exercise and a good diet. We're all set.
Okay.